Welcome to Old Fashioned Health Network, Good Health Inside and Out. My name is Joanne Fowlman, your registered dietitian and the host of the Nutrition Show. Today we're going to talk about the silent killer, known as high blood pressure. Now I know most of you have dealt with high blood pressure somehow in your lives. Myself, both my parents, most of my aunts have been battling this disease for years. Now, some people have no choice but to take medication because they've allowed it to get so out of hand. But most of us can learn to manage our high blood pressure through our diet and our lifestyle changes, and even prevent ourselves from getting high blood pressure. So there are a lot of lifestyle changes that you can make to help you maintain or even reduce the risk of you getting high blood pressure. But there are a lot of factors that can increase your risk of getting high blood pressure, such as genetics, if you have a family predisposition of it, your race, African Americans are at a higher risk of getting high blood pressure, your age, the elderly, the older you get, the more likely you are to get high blood pressure, and your lifestyle. So if you are sedentary and you are obese, you're more likely to increase your risk of getting high blood pressure. Now, the dietary guidelines for Americans have recommendations that they've made out there for everyone. So people who are age 2 and older are recommended to not eat or consume no more than 2,300 milligrams of sodium in a day. Now, this number is different for certain groups. So specifically the categories I just spoke to before. So people who are 51 years and older, people who are African American, or African origin, and those who have high blood pressure are recommended not to eat any more than 1,500 milligrams a day. Now that is not a lot at all. If you were to look at a back of the salt bottle that you use at your home, the serving size is about a third of that recommendation. So we really have to watch how we're preparing our foods. Now, when I deal with my patients, what I usually tell them to do, the first thing in their diet is to watch their sodium intake. So most of us have heard about the sodium that we find everywhere, the foods that are processed, especially in the United States, canned goods such as soups and tomato sauces, your cheeses, your deli meats, even the foods in our fast food restaurants. We've heard about those being so high in sodium that even one serving would be more than your recommended daily allowance. Also, we recommend that you try to increase your potassium intake through natural sources like your foods. So we don't recommend that you take supplements because there is such a thing as taking in too much potassium that can harm your body. But if you do it through your food, the likelihood of that happening is very low. So eating foods such as potatoes with the skin on, because that's where most of the potassium is, bananas, lima beans, even tuna, are high in potassium. So eating those natural foods and including them in your diet some way, somehow, help you increase your potassium intake, which also helps you manage your blood pressure. Now, there are other lifestyle changes that I always recommend for my patients, such as making sure that they have some kind of cardio in their lives 3 to 4 times a week. Running, walking, that's the heart health recommendations that we have for most everyone. If you drink alcohol, men, we don't recommend you drinking no more than 2 cups a day. 2 servings a day, excuse me. And women, we don't recommend that you intake more than 1 serving, no more than 1 serving in a day. If you smoke, quit smoking. So I always tell people, make your plate as colorful as possible. If you're cooking at home and you're reducing your processed food intake, what does that mean? That means that you're intaking less sodium, because a lot of sodium is used as a preservative in processed foods. So if you reduce your intake of processed foods, if you're cooking more wholesomely at home, you're preparing your foods at home, the chance of you having a high sodium intake is less than others, okay? And finally, reduce your stress in your life. Live life. Okay, if you are living a stressful life, that's going to increase your risks of increasing your high blood pressure. And if you don't have it, it's going to increase your chance of getting it. Okay, so talk to your friends, find something to do that's going to release the stress. Maybe 10 minutes a day if you have a full work day, just to yourself, so that you can clear your mind and reduce your stress level. Thank you for watching Old Fashioned Health Network. I'm Joanne, host of your nutrition show. See you next time.